I was requested to record 3 questions about the challenges that I experienced within my internship. One of the most challenging experience in Tampa General was to work without any type of assessment. It was difficult to get the information and record on a piece of paper and making sure I got all the information correctly during the assessment. Basically, the first assessment was more preferences of the client. But then when we have the chance to work with the client and look at the deficiencies or the strengths that the patient had, I didn't have like an assessment to help me out measure that. So that's one of the things that I think was the most challenging. I understand that there's goals and plans that depend on that information, so it was a challenge not to work with the ICF and learning to work with it. My second question, what did you learn about yourself during the internship? Very good. I learned that I have many areas of recreation to explore that I want to learn from. As a recreational therapist, I also learned that it's a constant research that we need to be informing ourselves about evidence-based practice and learning from what they have done that we can use with our patients is helpful, that we keep ourselves updated. Also, I learned that I need to be more calm, less anxious, and go with the flow. I was kind of excited and wanted to do everything all at the same time. But it's important to communicate with the coworkers and finding out what the project is, what we're planning to do, and some sort of a meeting, like the same meeting that doctors do, is excellent, that the recreational department sits down and talks about it, because that way you know what is the department doing correctly and what we can do better. So that was one of the things that I learned during my second internship on the first rotation. My last question, what type of skills would you like to get more experience on? Well, some of the skills that I want to learn from is documenting better, using more technical words during my documentation will help. Showing a little more technical information. I was told before that for people you have to speak simple words, but to writing down a progress note, you need more technical words, and it will help you to finish sooner your report. I also would like to learn to get more trainings on videos, assessing patients. I think the videos will help you look at your mistakes and change them. Look at the part where you feel fear, why you feel fear, and change it when you're interviewing a patient. I get very anxious, short of breath at that time. And I also would like to learn to be more stable when the meetings with the patients and build limits for emotions. Sometimes you get very attached to the patient, you want to help them, you want the best for them, but then nothing works and that hurts emotionally. So I need to build a little bit more of that separation between patient and therapist. And that's all what I have today. I hope to hear from you guys and listen to your messages. Thank you.